Thank you, Louise. I've asked Louise if she wouldn't mind taking questions. Just while people are making their way to the microphone, if you do have questions. I was sitting there thinking, listening to Louise and reflecting on the fact that the group here today, I think, probably doesn't include too many people from the early childhood sector or the child protection sector. These, this is a mental health network, if you like, and I think if we're going to be serious about moving forward this agenda on trauma-informed care and practice, we're really going to have to broaden it out to include those sectors. So that's a big learning I've had from Louise's talk today. So, questions?
Yeah, thank you. Thank you. Aboriginal women. We now have more kids being removed. I'm an Aboriginal woman. We have more kids being removed now through child protection legislation across every state of Australia than we've ever had before. And we have such inadequate programs. And what you've talked about, I know. And yet how the hell do we get to government and to understand? I mean, I worked with a woman who had 5 generations in her family of women who had been removed, who had never had a model parenting. She's now working with women in a prison. Every single one of those Aboriginal women have got severe trauma, and all of them themselves had been removed under the whatever you want to call it, stolen generations, whatever. And every single one of those women have had their children removed. I work with a woman, an Aboriginal woman, who is 18 years of age, and she's had 4 children. And every single one of those children has now been removed. Mm. What do we do in this country? I mean, I'm sorry. You're speaking such a truth. And I feel so inadequate. And I have spoken to these issues for so long that if we start with those little fellas, and I just want to relate something to you all because it's been preying on my mind from yesterday. We watched a video of a woman and her bubby. And this is about education, right? I sat through this professor of child and adolescent psychiatry doing a presentation, and he showed this mum and this bub over a 3-year period. So in the beginning, the bub is just engaging with the mum beautifully. And then the next stage, it's a little bit back. And by the time the bub is able to crawl, when the bub crawls into the room, just gets into, and it's not like engaging at all. It's just back in a retracted state of not being able to gauge it with anything. And he's blaming the mum. She doesn't have the capacity to attach with the child, he says. Look what's happened. The attachment is fractured. And then in the middle of it, he just acknowledges that during the whole time they've been involved in this longitudinal research study that cost something like, $3 million, this woman has been subjected to domestic violence. So this child, this little boy child, already knows, and he's already been programmed when he's an adolescent. Isn't that the research? That he's going to behave that way on other women? My question to you, and you're at Monash, I used to be at Southern Cross, and I am really sick of universities who dish out, crap in their educational programs that do not teach what we absolutely need. How do we get together and put in place these educational programs so that we can actually skill our, and I'm talking particularly as an Aboriginal woman, but I've also worked with refugees, and I've also worked in Timor and PNG. How do we skill at a community level people to be able to work with those young mums and those bubs and the young dads if necessary? And if necessary, we do it outside of the universities who've lost the plot as far as I'm concerned. That's my question.
I think you actually asked a lot more questions, but thank you for that. They're all really relevant points. Look, I'll just say a couple of things, but happy to talk with you more about it because it's hugely important and significant what you're saying. Firstly, about child protection. And I hope I made it clear that I think the system at the moment is based on what they see as risk assessment and removal. And you're quite right, and particularly for Indigenous communities, obviously, this has been a huge injustice. The issue, I think, is much more about how we're going to, yes, identify risk factors and difficulties that people might have, the real experiences that make parenting hard in communities, and then actually help support people by the development of appropriate sorts of interventions that actually meet with people where they are. We're only at the beginning of that, because you're quite right, we haven't had an approach that thinks in that way. And the stolen generation is one example, and there are others of, again, fundamental social injustice that breaks down attachment relationships, is re-traumatising, and can decimate communities and society. So I absolutely agree with you about that. I have to say something about the universities. The issue of should the universities be doing more about this and teaching this sort of stuff? Obviously, yes. Yeah. Some universities do it more than others. Should things be happening outside the universities at the service level? Absolutely. So a lot of the trainings I would do are not within the universities. They're with people who are home visitors, child protection staff, people who work as family support workers, people who actually early maternal child health nurses who need to know and have a fundamental orientation, which is because of the work they do out there, is about supporting parents and early development. The other point you made, it was a very important one, about do we need to know the context of people's lives when we make diagnostic assessments or judgments about attachment or whatever? Yes, absolutely. It's a very good point that you made. If a woman's in a situation where she's being exploited, re-victimised, beaten, of course her parenting can be impacted upon by that. We don't want a model that sort of is based around individual pathologisation or medicalisation of social and cultural and political context. So, I mean, I absolutely agree with you about that. I think then you ask the big question, how are we going to do it all? I don't know. Thank you.
Just one more quick question.
Hi, I'm from the CAM sector, and I'd just like to comment what Jenna said about, we need child protection at the table, we need a few others. We don't even have CAMs in the room, hardly. Mm-hmm. There's only a few of us, I'd say a few handful of people that I've talked to who are from the CAM sector. So we don't even have child and adolescent mental health services here, and which yesterday we heard a lot about, the trauma and what's happened, and it's like suddenly they're adults and we're dealing with them in those services. There's a whole lot in between, so thank you, Louise, for letting us know about that early childhood, but there's a whole spectrum there that we're missing.
Well, that's what I meant. I think, thank you for that, but about a developmental framework. We do not catch mental disorder or problems like the common cold in adolescence. These are developmental problems that occur within a particular context, which is about relationships, attachment, and we know a lot about the neurobiology of that, but we need to get better at actually picking that early, so I might do very early. Yep. But a lot of the children that we see within CAM services who end up with a myriad of diagnoses. I mean, we've spoken a bit about the diagnosis of borderline personality disorder. What about attention deficit hyperactivity disorder, Asperger's, juvenile onset bipolar disorder, bandied around on abused and traumatised children? And all that does is stop everyone thinking about the reality of trauma in those children's lives. It's a reductionist, medicalised model that suggests that there's a pill that will cure trauma. Trauma and the effects on children and PTSD, to my way of thinking, is not cured by psychostimulant medication.
I agree.
That's a very good note to finish on.
Thank you very much.